Hi, today I want to talk about knee pain and how it might be related to how your foot functions. In particular, today we're going to look at a condition called patella-femoral dysfunction, also commonly called runner's knee. On the website, you can also find information on other conditions that affect the knee, such as arthritis of the knee. Now let's orient you to start with. So here's a foot. This is your tibia bone and your fibula here. And then over here on this knee model, here's the fibula and here's the tibia bone, all right? Now, there's a fair number of studies that have shown that when the foot pronates or flattens out excessively, as that occurs, the leg rotates inward. And as that leg rotates inward, that can throw the knee offline. And so that goes in, that pulls the kneecap off to the side. And so the kneecap, which should lay directly in this groove on the femur bone, is pulled off to the side. So there's a number of studies that have showed that on people who pronate or flatten out too much, if we can put something underneath their arch to stop them from rolling in, by stopping that from happening, we stop the leg from rotating to the inside and we keep the knee functioning straight ahead so the kneecap doesn't get pulled off to the side. That allows normal motion of the knee. Now, I think it should be made clear that by no means is every knee problem and every case of patellofemoral dysfunction caused by foot function, but there's a fair amount of research that shows that in many patients there is a relationship. So I think it's very, very worth trying to stabilize the foot, to try, if you do have these problems. You see us, we can definitely take a look at you and do a biomechanical exam and determine whether or not there's likely to be an issue. Now, if you are going to treat this problem by supporting the foot, you have a couple options. Number one is to make sure your shoes are stable. You want a shoe that's firm on the heel, doesn't twist too easily. Number two, you can try a high quality over-the-counter arch support. If you go to our website and do a search for runner's knee or patellofemoral dysfunction, you'll find a list of some good arch supports. And then finally, if that's not enough, we can use a custom orthotics. Custom orthotics tend to work better than the over-the-counter ones for this problem because they conform tighter to the arch of the foot. And by conforming tighter to the arch of the foot, they do a better job at stopping the foot from rolling in. So if you're in our area and you're having knee pain that's not responding to other treatment, please come in. Make sure to bring any shoes and arch supports you may be using with you. If you're not in our area, find a podiatrist that specializes in sports medicine.